you for tuning in. I know it's been a minute since I have posted, and I'm so sorry about that. But hey, I'm here now, and your girl Kovan missed you guys. So thank you guys for tuning back in. I appreciate you. I did miss you. And as always, I'm grateful for you guys taking time to check back up with me and hear what I have to say. So, I have a lot of updates for you guys. There is a lot of information that I need to give you. I'm getting closer and closer to joining the losers bench, and my surgery is getting closer and closer. We're in a new year. The pandemic is still raging on, and I know we all have cabin fever. And so, hey, it's been a minute, and it's been rough, and it's been tough, but thank God we made it, and thank God we still here. As promised, I told you guys that this next video was going to be about me getting rid of these pesky, burnt out gray chin hairs, and we will be getting into that a little bit later. I just wanted to first give you guys some background information about a serious health condition that a lot of women have been facing and battling for many, many, many years, as well as myself. I personally have been dealing with this situation for over 20 years, and I believe that it is genetic. There is some medical information that backs that up. I also will be reading from Google so that you guys can get some medical background information about exactly what PCOS is. So for those that don't know what the issue is, and for those that are aware of what this medical condition is, it's plaguing so many women, and a lot of people don't talk about it because they're either embarrassed or they're just frustrated and shy and don't want to talk about it, or afraid to talk about it, whatever the case may be. I'm here to try to empower those women and women who happen to not be afraid to talk about it and are currently going through this issue. We're here for each other, as I've always stated in my previous videos. And so I just want to help and uplift women so that we can help each other through these difficult times. Polycystic ovarian syndrome is what the technical name for PCOS is. And when the women mostly get this type of issue, you will either have facial hair, you can get the chin hairs, you can get a mustache. Some women even grow full beards. Being overweight is a problem. Not being able to get pregnant is another issue. Irregular periods, and the list goes on and on. There's no cure for this disease. They don't really know why it happens, and to some women and not other women. And there's no particular medication that can try to reverse the situation. More times than not, they always try to put a woman on birth control. And there's been a lot of data that being on birth control can actually make the situation worse rather than helping it. So I believe that if we have these type of dialogues and people speak out about it a little bit more, it can help to empower someone so that they can try to focus more and do more research so that this can be reversed and curable. Because so many women want to have children and can have children, and the people that can have children don't always want to have their children. So it's a very frustrating situation. There's other updates that I need to give you guys. I'll be doing a couple other videos on those things, but today's video will be about the PCOS, me doing the I'm going to do a versus video about 2 different items that I'm going to be trying to see which one is going to work better in order to remove the facial hair. When I was younger, I did tweezing However, I wasn't a big tweezing fan. I've watched my mom do that a lot, and it just never was a good look for me. And I believe my grandmother used to do it too. But I always got turned off by seeing my mom do that. And so, consequently, when I began to get facial hair, the quickest way for me to get rid of it was to just shave it. And that ended up not really being a good idea because obviously the hair grew back quicker and it grew back thicker and it grew back faster, which means I would have to shave more constantly than normal. And so a lot of times I would just get so frustrated and be like, I don't even care. So I'd have family members telling me, oh, you need to shave. And, sometimes even partners that I may have been dating at the time would tell me that I need to shave. And so I've had to be very frustrated over the years with dealing with trying to get rid of the facial hair. Now that I'm getting older, the hair is coming in gray, so that's even more irritating. And so I'm finding that shaving is actually not really working for me now. So I'm trying to find other means of getting rid of it. My sister actually sent me some type of home waxing strips. So that's one of the things I'm going to try. And then I also came across something at Didi's Discount. So I'm going to be doing a versus against the thing that I found at Didi's Discount and the item that my sister happened to mail me. Before I get into that, I would like to do a little background information as far as what PCOS is on the medical side. So for those that need to have a little more clarification as to what the disease happens to exactly entail and what the medical definitions say. So we want to talk about that. But I also wanted to talk about that I came across a great deal when I was happening to watching The View one day, and I got this cool scale that is a very smart scale. It works with your telephone, and you can have up to 8 users use the scale, and it can keep all the information of all 8 users. And not only does it take your weight, but it also takes your whole body weight, your water weight, your muscle weight. You can connect it, tells you how to, if you want to connect it to a nutrition app, you can do that. You can connect it to MyFitnessPal. It counts your steps if you want to count your steps. So it does a whole lot of great things. So I want to show you guys that scale as well. I caught it on a deal on the View Your Deal, like I said, when I was watching The View one morning. So I think I'm not anyway trying to am I going to be getting paid for giving you guys any information about the scale, but I just thought it would be something cool for people to know if you were interested in getting a scale that can give you accurate weight. I know that a lot of different scales, sometimes they not are reliable. So this one's been pretty accurate. They also include the little carpet feet. So if you happen to have carpet in your house, or you don't have tile or something like that, and you want to weigh yourself on carpet, you have the option to put the carpet feet on the scale, or you can remove that if you have it on a flat surface, like in the bathroom or in the kitchen or something like that. And then that way you can take off the carpet feet and just lay the scale flat and get an accurate reading like that. I did notice that it will read 2 different weights if you put it on different surfaces as far as the carpet and the tile. So just be careful about that. They have a website that I could provide with you guys if anyone's interested in trying to obtain this specific scale. So I'll be showing you guys the scale, and also giving you guys an update as far as what's going on with my progress for the bariatric surgery. I am on track for that. I have 2 more nutrition classes, and then after that, they should be submitting everything to the insurance, and I should be getting a surgery date. I have lost about 20 pounds on my own. Woohoo! So that's good. That is a blessing. So It's not a lot, but you know, every little bit counts. I'm shrinking my liver, which is a good thing before surgery. And so I have, you know, ups and downs, smiles and frowns, but everyone, as I said, you know, baby steps. And I'm definitely proud that 20 pounds is not easy to do, especially on your own. Yes, I still have different sweet cravings. You know, yes, my diet is not totally perfect, but I am making small changes. Like, for instance, I don't drink sugar drinks like juice and sodas. I've now started purchasing sugar-free drinks, drinking more water, um, looking at the back of the food labels to see exactly what the contents contain in food I buy, or you know, specific things like that. So I'm being more conscientious, which is a good thing. I have had a slip up in regards to smoking. I started smoking again. I told you guys that I had quit smoking a couple of videos back. So I have to get that back under control. But for the most part, I've been doing good. And so I have to pat myself on the back for that. But, you know, hey, it's a struggle. We have all been locked up for like almost a whole year now with this pandemic. Everybody's been having cabin fever. So things have been definitely in a tumultuous time. And so we haven't really been able to visit loved ones and go out, or, you know, to different places, or, you know, visiting gyms or whatever the case may be that is your normal outlet. So a lot of people have been gaining a lot of weight because they're just staying in and not being able to be active as they normally do. So I'm pretty proud of myself to be able to have lost the weight. I did tell you guys that I was receiving some type of medication that was being helpful, like the phentermine and the topramate. I no longer am taking that medication, but even before I started taking the medication, I had already lost some weight before I even started that. So I still am on track. I have to have one last appointment for the gastric to see if I have the acid reflux under control, and that's for a whole nother video. But right now I would like to show you guys the medication that they have given me, because as I was telling you guys earlier in regards to the birth control, I previously was on birth control several years back, because normally, like I said, when you have PCOS, the first thing that doctors, OBGYNs, normally like to do is they would prefer to hurry up and put you on birth control. I have had issues with that in the past, because normally when you get birth control, your hormones are already out of whack, and it can cause you to gain even more weight than, you know, you already have. So I have currently not had a menstrual cycle since November, and I went to my OBGYN in regards to this. And so the lady she wanted to give me an IUD, because she said that due to my age, the concern with PCOS is not the fact that I'm not having a period, but it's the fact that the lining, because the lining is just building up because the blood is not shedding. And so their concern is that I don't get uterine cancer, because that's another thing that you can get in regards to polycystic ovarian syndrome. So she prescribed me this medication. I don't know if you can see it, but it's called Mediprogesterone. And it's for 10 milligrams. I'm supposed to take it for like 14 days out of the month. And then after that, I'm supposed to have a cycle. The first time I was prescribed the medication, it worked, which was back in November. But then when the next month came in December, I did not have a period, and I have not had one since then. I've already finished the medication for this month, but still no cycle. So I'm still waiting to see if something's going to happen. But she did tell me not to be alarmed, that if I didn't have a cycle, that it would help to still at least shed the lining, even if no blood actually came down. Sorry if that seems to be a little bit TMI. So it is definitely a struggle for women to have to deal with this, because I mean, it's like we have so many other things that we can be like going through, and you know, not having to worry about your womb failing you. Basically, it feels like my body is failing me because I'm not being able to have a normal menstrual cycle. I haven't been able to have another child. I do have one child. My daughter is 28 years old. I was a teen mom. I had her at 15. I was pregnant at 14. And unfortunately, I have never been pregnant since then. Not to say that I haven't wanted to have another child, which I have. I've even went to have several fertility clinics. I've taken fertility medication, paid hundreds of dollars for the medication, charting my temperature every morning, even charting down every time I had sex with my partner that I was with at the time. It's very frustrating and heartbreaking when the thing you want most you can't have. And so I know that it's a silent, struggle that a lot of women are facing by themselves. And that's why I wanted to dedicate this particular video to that. I just recently had some blood work done, and I would like to share the blood work with you guys because it's very relevant to what we're talking about right now. Because as I stated, polycystic ovarian syndrome is a disease that means you have more male hormones. Women have more male hormones than female hormones. And my particular hormone level here, as you can see, testosterone free and total, my level was very high. Here you can see that it says my total testosterone, I don't know if you can see that, is 110 milligrams, where the normal range is between, or they say the standard range is between 2 and 45 ng. And my value was 110. That was the total testosterone, was 110. And my free testosterone level was 11.4. But the standard range is between 0.1 and 6.4. So that's pretty high. That's way high. And that's very alarming that I have that many male hormones circulating through my body, and they have me taking these birth control pills, and it's still not regulating me to get into a normal range. Here is where you see the standard range number. I don't know if you can see it very well, but I'm just trying to give you guys an idea of something in black and white, what a blood test has shown of the levels of what this disease does. And so that's something that, like I said, I've been dealing with since my early 20s is when the situation first occurred. And I've had no relief. I'm 42 now. I'm pretty much at what they call post-menopause stage. If I was to get pregnant, they would consider me to be high risk because I'm over 35. And most people say, well, why would you even want to have another child as old as you are now? Well, I don't really feel that I'm old. 40 is the new 20. But realistically, I know that I want to, if I don't do it now, by the time if it doesn't happen by 45, then it just probably won't happen. Which is part of the reason why I'm trying to get bariatric surgery, because a lot of people have found that once they do have that surgery, PCOS is, I don't want to say that it's kind of reversed or that it goes away, but once you do lose all the weight, because it is associated with being obese and overweight, you know, a lot of people, once they do have these surgeries, they do end up getting pregnant, which is why they say they want you to wait within your first year after surgery, because your body has to get back, you know, get back in line or whatever, and you still have to heal and get used to your new stomach and things like that. So to get pregnant in the midst of trying to adjust to your new stomach, and it's kind of a dangerous situation. And because your body is lost all that weight in a drastic way, your hormones are all of a sudden out of whack, and it's easier for you to end up getting pregnant because, you know, for whatever strange reason that is. According to Google, it says polycystic ovary syndrome is a condition that affects a woman's hormone level. Women with PCOS produce higher than normal amounts of male hormones. This hormone imbalance causes them to skip menstrual periods and makes it harder for them to get pregnant. PCOS also causes hair growth on the face and body and baldness, and it can contribute to long-term health problems like diabetes and heart disease. Birth control pills and diabetes drugs can help fix the hormone imbalance and improve symptoms, so they say. But that's not always the case. What is PCOS? PCOS is a problem with hormones that affects women during their childbearing years, ages 15 to 44. Wow. So I'm right in that range, 15 to 44. Now imagine that. Between 2.2 and 26.7% of women in this age group have PCOS. Did you guys hear that? 2.2 and 26.7%. That is a lot of women in this age group. And again, that age group is 15 to 44. And again, I'm 42, so I'm 2 years away from this age bracket that they're saying, right? And actually, I'm 1 year, because tomorrow is my 43rd birthday. Many women have PCOS but don't know it. In one study, up to 70% of women with PCOS haven't even been diagnosed. PCOS affects a woman's ovaries, the reproductive organs that produce estrogen and progesterone, hormones that regulate the menstrual cycle. The ovaries also produce a small amount of male hormones called androgens. The ovaries release eggs to be fertilized by a man's sperm. The release of an egg each month is called ovulation. Follicle-stimulating hormone, FSH, and luteinizing hormone, LH, control ovulation. FSH stimulates the ovary to produce a follicle, a sac that contains an egg, and then LH triggers the ovary to release a mature egg. Well, in PCOS, it's a syndrome or a group of symptoms that affects the ovaries. So again, PCOS is a syndrome that they're calling it, or a group of symptoms that affects the ovaries and ovulation. It's three main features are cysts in the ovaries, high levels of male hormones, irregular or skipped periods. So again, that's cysts in the ovaries, high levels of male hormones, irregular or skipped periods. In PCOS, many small fluid-filled sacs grow inside the ovaries. The word polycystic means many cysts. These sacs are actually follicles, each one containing an immature egg. The eggs never mature enough to trigger ovulation. The lack of ovulation alters levels of estrogen, progesterone, FSH, and LH. Estrogen and progesterone levels are lower than usual, while androgen levels are higher than usual. Extra male hormones disrupt the menstrual cycle, so women with PCOS get fewer periods than usual. PCOS isn't a new condition. Italian physician Antonio Valseri first described its symptoms in 1721. Wow. So here we are in 2021. So imagine, let's go back and let's just do the math on that. 1721, and we're now in 2021. That's 300 years. 300 years, guys. So we women have been dealing with this for 300 years. Can you imagine that? And in 300 years, they still haven't came up with a cure. What is going on in America? Seriously. So to summarize it, polycystic ovarian syndrome affects up to almost 27% of women during their childbearing years. It involves cysts in the ovaries, high levels of male hormones, and irregular period. So what causes it? Doctors don't know exactly what causes it. They believe that high levels of male hormones prevent the ovaries from producing hormones and making eggs normally. Genes, insulin resistance, and inflammation have been linked to excess androgen production. Genes. Studies show that PCOS runs in families. So as I stated earlier, my mom had the facial hair, my grandmother had the facial hair. So as I stated, it could have been a genetic issue. It's likely that many genes, not just one, contribute to the condition. Insulin resistance. Up to 70% of women with PCOS have insulin resistance, meaning that their cells can't use insulin properly. Insulin is a hormone the pancreas produces to help the body use sugar for foods for energy. Insulin is a hormone the pancreas produces to help the body use sugar from foods for energy. When cells can't use insulin properly, the body's demand for insulin increases. The pancreas makes more insulin to compensate. Extra insulin triggers the ovaries to produce more male hormones. Obesity is a major cause of insulin resistance. Both obesity and insulin resistance can cause your risk of type 2 diabetes. Inflammation. Women with PCOS often have increased levels of inflammation in their body. Being overweight can also contribute to inflammation. Studies have linked inflammation to higher androgen levels. I also have inflammation because I happen to have a bad knee, and my knee swells up if I happen to do too much in walking or standing, anything like that. So I suffer with swelling anyways because of that. So imagine I'm battling like all of these that we're just discussing in this reading right away. So I can't win for losing according to this article right here. Summary. Doctors don't know exactly what causes PCOS. They believe it stems from factors such as genes, insulin resistance, and higher levels of inflammation in the body. Some women start seeing symptoms around the time of their first period. Others only discover they have PCOS after they've gained a lot of weight or they've had trouble getting pregnant. The most common PCOS symptoms are irregular periods, a lack of ovulation, preventing the uterine lining from shedding every month. Some women with PCOS get fewer than 8 periods a year. Heavy bleeding. The uterine lining builds up for a longer period of time, so the periods you do get can be heavier than normal. Hair growth. More than 70% of women with this condition grow hair on their face and body, including on their back, their belly, and their chest. Excess hair growth is called hirsutism. Acne. Male hormones can make the skin oilier than the usual and cause breakouts on areas like the face, chest, and upper back. Weight gain. Up to 80% of women with PCOS are overweight or obese. Male pattern baldness. Hair on the scalp gets thinner and fall out. Darkening of the skin. Dark patches of skin can form in body creases like those on the neck, in the groin area, and under the breast. Headaches. Hormone changes can trigger headaches in some women. So the summary of that is PCOS can disrupt the menstrual cycle, leading to fewer periods. Acne, hair growth, weight gain, and dark skin patches are symptoms of that condition. How it affects your body. Having heavier than normal androgen levels can affect your fertility and other aspects of your health. Infertility. To get pregnant, you have to ovulate. Women who don't ovulate regularly don't release as many eggs to be fertilized. PCOS is one of the leading causes of infertility in women. Metabolic syndrome. Up to 80% of women with PCOS are overweight or obese. Both obesity and PCOS increase your risk for high blood sugar, high blood pressure, low HDL, good cholesterol, and high LDL, bad cholesterol. Together, these factors are called metabolic syndrome, and they increase the risk for heart disease, diabetes, and stroke. Sleep apnea. This condition causes repeated pauses in breathing during the night, which interrupts sleep. Sleep apnea is more common in women who are overweight, especially if they also have PCOS. The risk of sleep apnea is 5 to 10 times higher in obese women with PCOS than in those without PCOS. Sidebar: I also was just diagnosed with that in a recent test that I had to do for the bariatric surgery, but that'll be for another video. So I didn't even know that sleep apnea was connected to PCOS, so I just learned that in reading and sharing with you guys. So that's interesting. Okay, the next one is endometrial cancer. During ovulation, the uterine lining sheds. If you don't ovulate every month, the lining can build up, which is why the lady was saying that she wants me to take the medication that I showed you guys. A thickened uterine lining can increase your risk for endometrial cancer. And the last thing it says is depression. Both hormonal changes and symptoms like unwanted hair growth can negatively affect your emotions. Many with PCOS end up experiencing depression and anxiety. And yes, I also suffer with that, along with another mental illness called bipolar. I suffer with that as well. So to summarize that, it says hormone imbalances can affect a woman's health in many ways. PCOS can increase the risk for infertility, metabolic syndrome, sleep apnea, endometrial cancer, and depression. How it is diagnosed. Doctors typically diagnose PCOS in women who have at least 2 of these 3 symptoms: high androgen levels, irregular menstrual cycles, and cysts in the ovaries. And yes, I've had those as well. Your doctor should also ask whether you've had symptoms like acne, face and body hair growth, and weight gain. A pelvic exam can look for any problems with your ovaries. Usually when they do the pelvic exam, they do an exam with the ultrasound inside of your vaginal area. So a pelvic exam can look for any problems with your ovaries or other parts of your reproductive tract. During this test, your doctor inserts gloved fingers into your vagina and checks for any growths in your ovaries or uterus. And normally it's not fingers, like I said, it's the vaginal ultrasound, because it's actually some type of little tube thing, or like a long stick kind of whatever, and that's what they insert. It's not just the fingers. They actually have to look inside, because the ultrasound is what they used in order to see inside your vaginal area to see if you actually have cysts on the ovaries. Blood tests. Blood tests check for higher than normal levels of male hormones, which is what I told you I had done. You might also have blood tests to check your cholesterol, insulin, and triglyceride levels to evaluate your risk for related conditions like heart disease and diabetes. An ultrasound uses sound waves to look for abnormal follicles and other problems with your ovaries and uterus. So I do know what I'm talking about. Doctors diagnose PCOS if women have at least two or of the three main symptoms: high androgen levels, irregular periods, cyst in the ovaries. A pelvic exam, blood test, and ultrasound can confirm the diagnosis. Pregnancy and PCOS. PCOS interrupts the normal menstrual cycle and makes it harder to get pregnant. Between 70 and 80% of women have fertility issues. The condition can also increase the risk for pregnancy complications. Women with PCOS are twice as likely as women without the condition to deliver their baby prematurely. They're also at greater risk for miscarriage, high blood pressure, and gestational diabetes. However, women with PCOS can get pregnant using fertility treatments that improve ovulation. Losing weight and lowering blood sugar levels can improve your odds of having a healthy pregnancy. To summarize that, it says PCOS can make it harder to get pregnant, and it can increase your risk for complications and miscarriage. Weight loss and other treatments can improve the odds of having a healthy pregnancy. So if you do a diet and lifestyle tips to treat PCOS, treatment for PCOS usually starts with lifestyle changes like weight loss, diet, and exercise. Losing just 5 to 10% of your body weight can help regulate your menstrual cycle and improve PCOS symptoms. Weight loss can also improve cholesterol levels, lower insulin, and reduce heart disease and diabetes risk. Any diet that helps you lose weight can help your condition. However, some diets may have advantages over others, which is why I decided now to have the bariatric surgery. Studies comparing diets for PCOS have found that low carbohydrate diets are effective for both weight loss and lowering insulin levels. A low glycemic index diet that gets most carbohydrates from fruits, vegetables, and whole grains help regulate the menstrual cycle better than a regular weight loss diet. A few studies have found that 30 minutes of moderate intensity exercise at least 3 days a week can help women with PCOS lose weight. Losing weight with exercise also improves ovulation and insulin levels. Exercise is even more beneficial when combined with a healthy diet. Diet plus exercise helps you lose more weight than either intervention alone, and it lowers your risk for diabetes and heart disease. They also say that there's some evidence that acupuncture can even help you with improving PCOS, but more research is needed. So the common medical treatments are birth control pills and other medicines can help regulate the menstrual cycle and treat PCOS symptoms like hair growth and acne. Birth control. Taking estrogen and progestin daily can restore a normal hormone balance, regulate ovulation, relieve symptoms like excess hair growth, and protect against endometrial cancer. These hormones come in a pill, patch, or vaginal ring. Metformin. Metformin is a drug used to treat type 2 diabetes. It is also treats PCOS by improving insulin levels. I happen to take metformin because my doctor says that I'm pre-diabetic. I'm not fully diabetic, but my sugar happened to be over the normal limit, so I'm also taking that medication. One study found that taking metformin while making changes in diet and exercise improves weight loss, lowers blood sugar, and restores a normal menstrual cycle better than changes to diet and exercise. Clomid. This is the medication that I told you I had when I went to the infertility clinic. I was paying hundreds of dollars for. This medicine they're talking about now. Clomiphene, also called Clomid, is a fertility drug that can help women with PCOS get pregnant. However, it increases the risk for twins and other multiple births. Hair removal medicines. A few treatments can get rid of unwanted hair or stop it from growing. It's called Vaniqua cream. Is a prescription drug that slows hair growth. Laser hair remover or electrolysis can get rid of unwanted hair on your face and body. Surgery. Surgery can also be an option to improve fertility if other treatments don't work. Ovarian drilling is a procedure that makes tiny holes in the ovary with a laser or thin heated needle to restore normal ovulation. That seems a bit excessive. I've never heard of that one. I don't know if I would try that. So that It's just little medical information. And if anyone is wondering what I'm reading from this website called Healthline. I Googled it, and that's where I'm reading from. It says when to see a doctor. See your doctor if you miss your periods and you're not pregnant, you have symptoms of PCOS such as hair growth on your face and body, you've been trying to get pregnant for more than 12 months and you haven't been successful, you have symptoms of diabetes such as excess thirst or hunger, blurred vision, or unexplained weight loss. If you have PCOS, plan regular visits with your primary care doctor. You'll need regular tests to check for diabetes, high blood pressure, and other possible complications. If you've been concerned about that, you don't already have an endocrinologist, you can review your doctors in your area and find one. I suggest finding an endocrinologist because OBGYNs don't really try to dig deep in when it comes to PCOS, and they only want to try to do the surface work, and an endocrinologist is going to dig a little more deeper into the situation and they know more about how to deal with PCOS. So I suggest reaching out to that. And so the bottom line is PCOS can disrupt a woman's menstrual cycle and make it hard to get pregnant. High levels of male hormones leads to unwanted symptoms like hair growth. Lifestyle interventions are the first treatment doctors recommend for PCOS, and if they don't work well, then weight loss would be the next treatment. Medicines are an option if lifestyle changes don't work. Birth control pills and metformin can help restore them, but 9 times out of 10, that, doesn't always work either. So, menstrual cycles often bring about a wide array of uncomfortable symptoms leading up to your period. So, the end of the day, if you feel like you have any of these things that I've read about and you feel like that was talking to you, I encourage you to reach out to your primary care doctor. If you need a referral to an OBGYN, get that. And if the OBGYN is not helping you, ask to get a referral to an endocrinologist and keep seeking help because there is help. And I know that it keeps saying lifestyle changes, change your diet, eat this, eat that. We've done that, and a lot of times that doesn't work either. So don't feel like, you're a failure and it's all your fault and there's no hope for you. There's hope. And I believe there's hope for myself too. I've been trying so many years to have another child, so many years to get this weight down, so many years to do something about this crazy situation with the hair. And speaking of which, here's now where the time where I will show you the product that my sister gave me and sent me from Minnesota. So she sent me these wax strips. I've never been a fan of doing the wax thing because I don't like the idea of having the hair just ripped off the face. But I'm going to try it because I want to do something different than doing the shave thing. But I also, because I am scared of the waxing, I also came across this lovely little thing at Dee Dee's Discount, and it was as seen on TV. It says it removes the hair from the root. It's kind of like, it was supposed to be like a tweezer thing, and it says that it works like a tweezer. So I'm going to do a versus and see which one of these works best. Is it going to be the wax strips, or is it going to be this little Epi Smooth tweezer like precision hair removal tool that I found at Dee Dee's Discount? So I'm going to pause for now, and we're going to take this to the bathroom, and we're going to see which one of these two items is going to do the job to get rid of this gray pesky hair on my chin. So, BRB, I know I've been talking for a while. Have patience with me. Thank you for listening all this time. I'm sorry if I've been rambling on, but I promise you won't be disappointed. I'm going to try to make it as fun and as interesting as possible. And, hey, we're gonna have a good time with it, okay? So, we're going to take this to the next step. And we're going to go ahead and move to my restroom now. I'm going to pause the movie for a second while I get set up. And you guys bear with me, and I'll be right back. Hey guys, I'm back. So in the box, the face wax box, included is a thank you card. On the back they say to send the feedback on how the product works. These are the wax strips, and they also give you some post waxing calming oil. So what I'm going to do is I'm going to do one side with the waxing strips and the other side with the Epi Smooth tweezer like machine that I got from DD's, and that's this. You guys can hear that. All you have to do is put 2 AAA batteries inside. So I'll be using this on one side of my face and this on the other side of my face. And then at the end, we'll see which one works better. So first I'll do the tweezer-like machine because this seems like it'll be quicker and easier. With this one, they say do something like a rub motion and then just leave it on and rip it off. So I'll do that one last. Okay, so we'll start with this one first. So I'm turning it on, and we're going to see how well this machine works and what is the prognosis. Welcome to my bright, lovely bathroom. I hope you guys can see exactly what I'm doing. And I'm about to get on with the get down. I'm using the Epi Smooth as seen on TV precision hair removal tool. As I stated, I'm going to use it on one side of my face, and then I'm going to use the other side for the wax strips. So here I go. So, it seems to be kind of sharp. Very sharp. No, I'm touching it. It doesn't seem to be doing a really good job. I don't know if it's because the hairs are long or what. But I'm having to go over the same spot a couple of times with this machine. And this is why I normally like to just use razors, because it's so hard to just get the stuff off. This is not working very well. I don't know if you guys can see the difference, but it's not really getting the hair off. So far this machine is a no for me, because as you can see, my hairs are pretty long. It got it off a little bit, but not really. I'm still seeing long hairs, and it doesn't seem to have removed anything. Yeah, this machine was a no. As you can see, it didn't really get anything off. The hair is still pretty thick. It said it took it off by the root. It didn't take anything off by the root. As you can see, I still have a substantial amount of hair using this Epi Smooth tool. So I'll put this down to the side, and we will try now for the wax strips, which is the wax strips that my little sister sent me, Nad's facial wax strips. So I'm going to now try this. On the back of the box, it says to just quick, simple, effective hair removal. And it conforms to delicate facial to remove the shortest hair. So we shall see what it does. Oh, it says just rub, peel, and go. Just rub, peel, and go. So we'll see. So I'm rubbing, peeling it. I guess I'm just supposed to put it on my face. So I'm gonna just go ahead and put it on both sides, since that machine didn't do very well with getting the hair off. Now, as you see, I put both here. Rubbed it on. I'm rubbing it on. Rubbing it on. And I guess now I can just rip it off. So now I'm going to proceed to ripping it off. Hopefully it will do a better job than the so-called precision hair removal as seen on TV. It didn't work well at all. Okay, well, let's see. If this doesn't work, I'm going to have to go back to my good old razors. Hopefully we will do better. We'll see. So here, I'm going to go ahead and rip it off now. Hopefully it works. So this one is kind of peeling up. I'm just rubbing it down. And I will proceed to peel it off now. So here we go. Oh, that hurt. Okay. Didn't do much of a difference either. We got a little bit of hair on it. Not much. Little bit, but not much. That was just one strip. And as you see, I still have a substantial amount of hair. So far, neither one of these are working. Here we go, second one. Ooh. Okay, that one pulled off a little bit of hair too, but not very much. So again, this side still has a substantial amount of hair still left. So those were the two wax strips. As you see, that both of them have a little bit of hair, not very much. I feel the stickiness, but there's still quite a substantial amount of hair still left on my face. Oh, that's very disconcerting. I don't know what to do. Go back to this machine. This is not doing anything. Oh. Yeah, guys, this is not working. Neither one of these are working. Unfortunately, I crapped out on both of them, guys. That sucks. So, unfortunately, I won't keep you guys much longer. I did the trial. You can see I still have quite a bit of hair left. I'm going to have to go back to my regular razor, unfortunately. But I used both tools. This, as you see, didn't pull off very much hair. This tool didn't do much either. That was pretty much a waste of money. So, unfortunately, I'm disgusted. But hopefully I'll be able to find something. If anybody out there has the same issue and has something that they know for a fact can get rid of hair besides a razor, I would appreciate any advice or any tip on something that doesn't cost a lot of money, that you know for a fact works. That would be great. I think the last thing that I can do for you guys now is pretty much show you the scale that I was raving about in the beginning of the video, and give you guys a brief look at that before I sign out and say goodbye. I know I've held you up for quite a long. This is probably my longest video. And again, I am sorry about that. Thank you guys for having patience. I am trying to wrap up quickly. But I just want to show you guys this great scale because it is a good scale. And if I got it on a good deal. This is the scale. It's called a Withing scale. And it is a smart body scale. Smart body scale. And also, if you happen to be pregnant, or if I happen to get pregnant, it can also keep chart of that. So it has in a nice box, Withings. And if you're interested, you can go to this name, withings.com. Withings.com. And when you sign up on your cell phone or your smartphone, iPhone, you just they have an app called HealthMate, and that is what connects your phone to the scale, and that way you'll be able to get keep a record of all of your weight, whatever your weight, where weigh-ins are, and any other information that the scale has for you. So it comes with a guide, Withings Body Quick Installation Guide. These are the carpet feet that I was telling you about. You just screw these onto the bottom. Whenever you are on carpet and you want to weigh yourself, you screw this onto the bottom of the actual scale. This is the scale. I'm going to take it out of the plastic. It's very beautiful. And this is the scale. Very beautiful. Just put it on. And there's a small button on the back. It comes on. And it says Start App. It connects to your phone. Once you connect it to your phone, it will register. Let's see if I can do it for you right quick. Actually, I probably won't be able to do it because I think I have it on the phone that I'm trying to do the video on. But this is the scale, Withing scale. It's a smart scale. The carpet feet go on the back right here. You just connect it and screw it on like that. And then if you want to get on and you want to take it off, if you want to put it on a regular hard floor, and that's it. So maybe on the next video I can give you guys a better description to show you exactly what the scale does. But this is a great investment to those who need to accurately track their information and keep track of their weight and stuff like that. It does, for those that are in the bariatric, it does have MyFitnessPal. It can hook you up to, if you want to keep track of your nutrition, things that you're eating. It can keep track of that for you. As I stated earlier in the video, it can keep track of up to 8 different people, all on one scale. So that's awesome. If you have a large family and you want everybody to get in on the same scale, so everybody can keep a track of, you know, their weight and if everybody's trying to get in on the healthy thing, that's also awesome. If you have a young infant, they can also get in on it. So I hope that everything that I said today was informative. I know this has been an extremely long video, and again, I do apologize for that, but I wanted to give you guys an in-depth video about polycystic ovarian syndrome, because it is a very serious disease that is affecting so many women, as you heard me read on the Healthline site that I Googled. So again, thank you for tuning in. I'm so happy that we had a chance to meet again. I'm sorry that it has taken me this long to get back on and give you guys an update as far as my progress. But as I stated, I am on track. I have 2 months to go with my nutrition classes. All of the required diagnostic tests are almost done. So everything's about to get sent over to the insurance, and hopefully soon I'll be able to let you guys know my surgery date. So till the next time, keep safe, keep your family safe, stay healthy, and stay as loving as you possibly can. Thank you again for tuning in. This is Kovan, and hey, let's just keep beating down those construction walls to the perfect person that we can be. And as always, family, don't forget to hit the like and subscribe button so that you can get notified when I post my next video. Thanks again for tuning in. Bye-bye.